I had the gastric sleeve. It's where they go in and they remove about 2/3 of your stomach, and it didn't involve any rerouting of the intestines, which is what I really liked about it, so I didn't have malabsorption problems. Went in one day, did it, stayed that night, went home the next day.
The difference with the sleeve compared to the gastric bypass is that there's no malabsorptive component to the surgery. So it avoids some of the long-term issues that can happen with the gastric bypass. In particular, there are very few vitamin and mineral deficiencies later because everything goes down the normal way. A lot of patients feel comfortable with it. They know that there's not something that probably may have to be taken out later on. The weight loss is very good. It's comparable in our patients to a gastric bypass, probably within 5% to 10% weight loss compared to the gastric bypass, which is the gold standard.
Last month we went on vacation. We were gone for 12 days up to the East Coast area. We walked through the Arlington National Cemetery, which I wouldn't have been able to do a year ago.
The operation, we like to say, is not an end in itself. It doesn't take care of everything. It won't lose weight completely on its own. But what the operation does do is it gives the patient a lot more control than they have before the operation. If you do the things that you've been trying to do to lose weight, if you exercise fairly regularly and consistently, even if it's not a lot, you will lose a lot of weight. If you eat right, if you decrease the percentage of carbohydrates and fats in your diet and increase the percentage of proteins and limit the total number of calories, you will lose a lot of weight. It makes the good behavior a lot more successful than it was before the surgery.
First of all, it's a tool. It's not a fix. Dr. Marvin and his staff will get you there. They will walk you through it. Make sure that you are taken care of, that your needs are met too. And that's what's so great about Dr. Marvin and his staff. It has made a tremendous difference in my life.